Hello and welcome to our series of public awareness programs. Today we have here with us Dr. Ozkor, who is a cardiologist based in Haringey and Enfield. Welcome and thank you for being here with us today.
Thank you for inviting me.
Heart disease in the UK is a major health problem, and in this area where we have a major Greek community, how can we prevent heart disease developing?
Well, I think that's a very important question. And I think what we've done in many years is not prevent but react to the problem, and what we should really focus on is prevention. The prevention is all about lifestyle changes really, and particularly in a population of the Mediterranean population where already the diet is meant to be pretty good. What we're changing to is changing that diet to a little bit more Western diet and also a bit more of an excess diet. So I think what we need to do is focus on what we're eating. And by focusing on what we're eating, we're trying to focus on a low cholesterol diet, because cholesterol is one of the risk factors for heart disease. We need to focus on blood pressure to keep our blood pressure nice and low. Not smoke, which is an increased prevalence in the community. In England, actually, smoking has gone down over the last 5 years. But in a Mediterranean sector, it's still holding steady. So we need to really address why we're still smoking and how we can improve that. And then exercise. And I say exercise, exercise, exercise.
It's really important. What are the major risk factors? You have already mentioned some of them that people can work on to prevent heart disease.
So the big five are smoking, blood pressure, high cholesterol, diabetes, and then a family history of having diabetes. As we go along, the Western diet is adding to it. Getting older, having kidney problems, being male, these are additive risk factors. But what we should focus on is the big five. So family history, you can't do a lot about your family history, but what you can do is notice that you have a family history and affect the others.
And tell your doctor too.
Absolutely, absolutely. And the doctors now and GPs have risk scores which they use, and the risk scores are different if you live in north of England or if you live in London according to the demographics. So it's scaled according to yourself. And really, as I said, smoking, if we could eliminate smoking, will make a big difference in heart disease. If we can watch what we're eating, then that will add to the benefit.
So obesity is a big problem?
Obesity is becoming the biggest problem. Lack of exercise in children, the development of diabetes, and if you've got diabetes, you have higher risks of having heart attacks, strokes, kidney problems, blindness, problems of your legs. So it's a big problem, and that's part of the diet.
So you've mentioned being male. Are males more at risk than women?
So up until the menopause, the hormones that women have protect them against heart disease. Doesn't mean they can't have it, but their chances are lower. But after the menopause, the women's risks quickly catch up with the men's risk. And so that's where we have to be careful. But men do have a higher incidence of heart disease, and so another focus. But then you could say that inherently, if you say who smokes more, is it men or women? And probably historically men do smoke more than women. So their risk factors are higher. And so I think it's a whole social aspect of it.
So if a person has a family history of heart disease, are they destined to develop heart disease?
So they're not destined to develop heart disease, but what I would do is assume that I have the highest chances of getting heart disease. So what I am going to do is reduce anything else that's going to increase that burden. So I am going to exercise, and I'm going to exercise for 30 minutes a day. And that is going for a walk. If you like swimming, people like going to the gym. I have some patients who like hunting, so I send them hunting. But as long as they do that activity. And the activity, people ask me, well, how much do I have to exercise, or what is the level? And one of the easy ways to look at it is that when you're exercising, you can have a conversation with the person next to you. But what you shouldn't be able to do is sing. So if you can sing while then you're not exercising enough. But if you can have a conversation, then that's cardiovascular. You move your heart rate up a little bit, and then you maintain it for about 20 minutes. And if you can do that for 30 minutes a day, then that has been proven, probably above everything else, to reduce your risks of having heart attacks. I would not smoke. I would watch my diet, and if I ate 6 different types of fruit and vegetables a day, that would automatically start to balance your diet. And you would start thinking about what you're eating. You wouldn't have fried food every day, red meat every day, change to oily fish a couple of times a week, which shows to reduce the incidence of having heart problems.
Omega-3, right?
Omega-3. Absolutely, omega-3. And you can have supplements of that. You can have a tablet that has a lot, or you can have salmon or mackerel twice a week, which will get you to the same levels in a healthier fashion. And trying to prevent these, what I call Western problems, which are smoking, the diabetes, the blood pressure. So blood pressure is a Westernized problem. It does run in families, but if we can exercise, if we can figure out why we are more stressed, because stress is something we can't measure, but stress undoubtedly has an effect on everything. And if we can reduce those aspects down and do what we enjoy more, then I'm sure we'll reduce those risks down. The other thing that we've got to remember is everyone is getting older. So these diseases, although we may be doing well as a younger age, we need to focus on getting the older age groups lower as well.
So everyone has to be aware of those factors since they're young, so they're careful.
Absolutely. And if you look at blood vessels, the majority of the problems develop in a young age. It's just that they show up older. So if you can prevent it from happening at a young age, then the older problems will be less.
So it's the prevention that we're talking about.
Absolutely.
So what do you see in the future of cardiac care?
So I think cardiac care, with our population getting older, is that we're treating older and older patients. For instance, I do a procedure where I change the aortic valve, which is a doorway out of the heart. And I'm doing that in 80 and 90-year-olds. So the demographic is changing on what we're treating. People are getting older. Yet I'm also seeing, I'm on call at the Heart Attack Centre at St Bartholomew's, and in that region I'm getting 39-year-olds, 40-year-olds coming with a heart attack. So we've got 2 different spectrums of people. And a great range. And a great range. And what we have is a population with ethnic diversity. We have people who were coming over from, let's say, India, Pakistan, from Greece, but that's now become 2nd, 3rd generation. We're seeing Eastern Europeans come over with different disease aspects as well. But what we should be doing is trying to focus on everyone's risk and bringing it down to then the future, I say, would be managing an older population. How do we manage an older population? And that may not be heart attacks, but that may be heart failure, because tablets like statins, for instance, have done remarkable in reducing the event of heart attacks. But what they're doing is then bringing the population 10, 20 years down the line to see you with a different problem. And the problem is now the pump is not pumping as well, and you're getting breathless. And so that is going to increase, whereas heart attacks may, if we do prevention well, decrease earlier on.
Thank you very much for the great information you have provided, and I hope we've helped many people in our area. Thank you.
Thank you.